Hi everyone, my name is Rachel Gershaw. I am the Leadership and Wellness Fellow at Baystate, and this is the COVID-19, Physician Health and Wellness During a Pandemic. All right, so it's March 2020, and life as you know it has turned completely upside down. Schools are closed, kids are home, and you can't eat at your favorite cafe where you used to go and get an hour of uninterrupted work done. The gym you went to maybe once or twice a week has now closed, and we have no idea when these things are going to reopen. You find yourself stuck inside, leaving only for your shift and to get groceries. You're still scared to do even that. Somehow you have more free time, yet it feels like so much less with everything that's going on and without your normal routine. Hit fast forward, now it's months later. You look in the mirror to find yourself the COVID-19 pounds heavier. You're ready to take a leap forward and to start a new, healthier routine, and you know that this is now the new norm. Maybe you're someone who has figured out how to eat well, exercise, and live a very balanced lifestyle over the past few months. I encourage you to still take some notes because you can pay this lecture forward to one of your colleagues. There are many things that we cannot control. Let's take a mental pause for a second. A pandemic is one of them. During the next few minutes, I want you to let those external factors go. Focus on what you can control, your mindset, your personal goals, and for the purpose of this lecture, your health and wellness. You owe this to yourself for everything that you have learned, adapted to, and were forced to change over the past few months. Let's take control over COVID and not let COVID control us. The COVID-19 is, metaphorically speaking, the excess weight or the 19 pounds that we have gained since this pandemic has started. It has been both physically and mentally in terms of having an increased burden and also possibly weight gain additionally. We've had increase in stress, a lack of routine, lack of normal exercise, and decreased quality of sleep. Many of these areas, a lot of us were already struggling with pre-pandemic, and now we have an increased burden of the fear of the unknown and social isolation on top of it all. COVID has certainly challenged us, working us to reach the life balance that we are trying to attain, and that's why optimizing physician health is important now more than ever. Wellness is not just the absence of illness and disease, but it's also the cumulative process of making good choices, leading us to our optimal and maximum potential. The wellness wheel has 7 spokes on it that are all interconnected dimensions and require attention to lead you to your optimal physical health and a balanced lifestyle. You are at the center of this wheel, and the decisions that you make in life right now are a reflection of the choices that you have made leading up to this point. Neglecting care and one of the 7 aspects of this wheel will allow the wheel to become flat on that side and thus lead you to become imbalanced. Physical wellness is an important spoke on this wheel, and it's one that's often neglected. So the goals for today's lecture are to understand the why, or the science behind and the benefits to improved physician physical health and wellness, the importance to making a change in our lives, how to find tactics, solutions for losing the COVID-19, and providing a toolbox and a framework to devise a plan, allowing us to assess and to reassess a portion of our goals during our current pandemic. If you believe your physical wellness is already optimal, ask yourself, are you actually doing 150 minutes of moderate aerobic exercise every week, walking 10,000 steps? Are you sleeping 6 to 9 hours per night? Do you protect yourself and others from getting ill? Are you limiting your alcohol and drug intake? And are you eating a balanced diet and maintaining an appropriate weight? Why are we discussing this? There was a 2020 Medscape Physician Lifestyle and Happiness Report demonstrating that most physicians do not spend enough time in their own personal life on health and wellness. That's why we're having this talk today. So there are 3 components of physical health and wellness that we're going to talk about today: nutrition, exercise, and sleep. Your resilience reservoir can be drained by a lack of attention in these specific areas. Optimizing health in each of these areas is ideal, but I do recommend that you work on just one at a time so you're not getting overwhelmed. The majority of this talk will talk about exercise, but I don't want you to neglect the other 2 of them. So what's the science behind this? Physical activity and exercise have been shown to have similar modulating effects as antidepressants. So they have an increased sensitivity to norepinephrine, serotonin, and neurotrophic factors, which regulate the hypothalamic pituitary adrenal axis and thus decrease inflammatory markers. There are studies looking at the role of nutritional status, diet, lifestyle, and their relationship to inflammatory reactions in respiratory illnesses, including COVID-19. Optimizing physical wellness may be a mitigation strategy to supporting our immune systems during this pandemic. We all know most of the information on this slide, but it's always good to go back and review the benefits of physical health on our well-being. Physical health and optimization improves cardiovascular health, it helps control our blood pressure, lower cholesterol, and it can decrease our rate of diabetes, arthritis, and cardiovascular disease. Ideally, it also can improve our metabolism and also helps with mental health, including lowering rates of depression and anxiety. It preserves our cognitive ability and can enhance our mood. It can reduce stress and help you to build self-esteem. Some exercises, such as yoga, tai chi, can enhance our mind-body connection. And regular exercise can improve your quality of sleep. Working out can also be fun and lead to better social connections and supports. Work-life balance, social and family support, adequate rest, regular physical activity correlate with improved sense of well-being, increased empathy, and decreased levels of burnout. This can all lead to improved career satisfaction. Physicians with healthy habits are more credible to patients and trainees and also better role models to their families. So this is the obligatory puppy picture. Sleep can help your body fight off infection, perform at its best, and in turn can positively impact your own personal wellness and well-being, and thus reflects on your patient. I do want you to know that you should adjust your expectations for sleeping during the day versus sleeping at night. So if you work overnights, sleeping during the day, your goal should be around 6 hours. If you're sleeping at night, it should be about 7 to 9. As emergency physicians, we are chronically deprived of normal sleep schedules. This deprivation has been correlated with decreased cognitive performance, increased likelihood of medical errors, and higher rates of injury, such as needle sticks. Some studies have shown that people who work nights may also be at an increased risk of certain types of cancers, metabolic syndrome, and type 2 diabetes. Poor sleep can have both negative health and safety consequences. Shift sleep work disorder is defined as a difficulty sleeping and excessive sleepiness due to a non-circadian rhythm-based schedule. This can lead to increased errors, accidents, and irritability at work. Solutions to combat this include anchor sleep or split sleep. So split sleep is essentially 2 4-hour periods of time that occur. This is going to be a great mode, especially if you find yourself at home homeschooling your children during the times you used to sleep consistently during the day. So that's 2 4-hour periods of sleep. Anchor sleep, as you can see on this slide, is a period of overlapping time that you have on both your work days and your days off. So you can see there from 8 to noon, that person is having their anchor sleep. I want you guys to make sleep a priority. Exercising when you wake up, whatever time that is for you, tells your body that it's daytime. A bright light source when you're awakening can simulate natural sunlight. So generally, bright or blue lights are going to be the best for that. These tell your body that it's time to wake up. Short naps are best. I'm going to recommend less than 20 minutes. Otherwise, I would do naps in about an hour and a half time intervals. Limiting caffeine for when you really need it will be best, as your body can easily build a tolerance to this. As mentioned before, try to keep your schedule as close to your normal routine as possible, even on your days off. Keep your sleeping environment cool, dark, comfortable. Most of us can do a great deal of work in the category of nutrition. What we put into our bodies is what we get out of them. We are often on the run preparing meals for families, as we have odd working hours, not allowing for normal meal times. Additionally, we do have to practice what we preach. Rather than promoting a diet, I am promoting an active lifestyle and a balanced lifestyle. one where you can meet your nutrition needs, but also allow yourself to enjoy and indulge on occasion. Eating poorly can make us again feel sick and irritable, leading to a decreased quality of patient care and increased medical errors. We should be eating a diet that is low fat, with plenty of fruits and vegetables, lean protein, and a balanced amount of carbohydrates. We should be limiting processed food and fast foods. I would also recommend eliminating or reducing the amount of sweets that you eat on shift, as although they can cause an energy surge, they are usually followed by a crash later on. One thing we often forget to do as we care for others is making sure someone else is caring for us. Please remember to get a regular checkup. We will now navigate through a 5-step process to achieving your personal health and wellness goals. This method can also be applied to other personal goals in your life, including emotional health needs. I encourage you to actively participate, grab a pen and paper, or write some notes down on your phone as we go through these steps. Step 1 is mindset. First, you need to gauge your level of readiness. Are you ready to make a change? It's okay if you're too busy this week, if you have too many shifts, you're on vacation. If you already have a routine, I want you to ask yourself if it's time to change it up, try something new or different, or increase the amount of time you're spending weekly. Make a promise to yourself to commit right now. How much of yourself can you realistically commit, and how much of a change can you actually expect? Go over these expectations over the next few days. Reflect on how much of a commitment, both mentally and physically, you're able to make to yourself. Don't overwhelm yourself in the beginning stages, or this won't become a long-term change. Is this going to be an individual goal or a group goal? Group can include family, colleagues, friends. Knowing that you need to find a balance to affect change will help you as you go on your goal endeavors. You already have so much going on in your lives daily that it sometimes seems hard to find something else. To find time for something else. There is enough time in a day, you just need to rediscover it. Step 2 is assessing your ability to make a change and assessing the type of change you want to make. Evaluate your needs. There are many different types of exercise, diet, and sleep habits. What does your body need? What are you naturally good at, or what do you enjoy? What are you drawn to? Identify your target area where you would like to see improvement. Do some research on the different types of exercise, sleep, and nutrition. Some individuals might be looking for something that is more low impact, while others may be looking for something more high intensity, for something more cardiovascular in nature, some looking for healthier eating, and others for better sleep. Whether you're going to do this change individually on your own schedule or as part of a team, there's also plenty of scheduled and on-demand classes that you can find. Some are free and some require equipment and subscriptions. Figure out your own personal financial commitments as well. Make sure you understand your body's limitations. If you have a bad back, a bad knee, make sure you're accounting for this in your plan. Now that we're in the right mindset, we've evaluated our abilities, it's time to set our actual goals. These can be weight loss, strength, flexibility, maintenance of your current weight, improving your diet, water intake, anchoring or split sleep. This can range from weekly to daily goals, from 5 minutes to an hour and a half. I do recommend that you start low and you increase slow. A book titled Getting Things Done, The Art of Stress-Free Productivity, recommends a 4-step approach to setting your goals. These include do, defer, delegate, and delete. This is going to be incorporated into our strategy today. Do, write your goals down in your calendar, schedule your exercise, your diet change, or your sleep schedule. This can help you feel accomplished when you've satisfied your goal, and you want to make them attainable. It's okay if you're only scheduling in 5 to 10 minutes to begin with. 10 minutes of exercise is still exercise, and 1 healthier meal per week is still 1 better meal per week. Defer. If it's not the right time to start, mark in your calendar when you're going to revisit this. Delegate. Is there someone else who can help you attain your goal? Maybe having a spouse cook a meal a few times a week that is a little bit healthier will take this burden off of you. Delete. Freeing yourself from another commitment might allow a little bit more time for you to devote to yourself and your new goal. Step 4 is adjusting. Select a time interval where you're going to commit to adjusting and reassessing your physical and mental needs. This can be every few days, weekly, monthly. It's a dynamic and ever-changing process that requires awareness and a lot of dedication. Here, I want you to ask yourself, am I meeting my goals? Do I need to higher or lower my expectations for myself? Adjust based on your weekly obligations, adjust for your vacation weeks. You might find here that you could benefit from someone else helping you out, holding you accountable, such as a coach. Continue to reassess, revamp your goals and expectations for yourself, and keep track of your changes. Step 5, one of the last and most important steps on the algorithm. Results. You get to decide what results mean to you. They can mean a few pounds of weight loss, increased strength, an hour more of sleep per week. Make sure you're keeping track over time so you can see your overall progress. Reflect. This is where you pause. Look back at how you've pushed yourself, made time for yourself, changed yourself. Any victory is still a victory. This is also a good place to set a meditation and mindfulness goal if you feel you're in the right place and it's not part of your current practice. Reward yourself for the changes you've made. Reward the fact that you have a new and improved routine. This can come in the form of a trip, a special meal, or a break from a busy day to do something that you love. These are some ideas for support resources if you find yourself needing a little bit of an extra push or someone to help coach you along. So it's a reminder that you're never alone and there are plenty of resources to help you through. ASAP has a wellness and assistance program. They offer a free 30-minute wellness coaching. Frontline Help also has this service for frontline staff. Baystate offers teletherapy and many EAP benefits. And Project Parachute is free teletherapy for frontline workers during COVID. In summary, we can do better for ourselves, and in turn, we do better for our families, colleagues, and patients. Improving our physical health and wellness has so many protective benefits. There are 5 steps to affecting change and attaining our physical health and wellness goals. Having the right mindset, assessing our abilities, setting goals, adjusting those goals regularly, and looking at results, reflecting on progress, and rewarding ourselves. We are not alone. There are resources to help us, and having someone on your team can improve results. Self-care is needed now more than ever. Thank you, and I look forward to seeing you all in person.
Thank you, Dr. Gershaw. I really appreciate sort of going through and giving us that kind of framework for being more successful. Would you mind if I asked you a couple of questions, just digging into a couple things that have always bothered me about this stuff and sort of to be effective? Do you know any, if there's any data on using things like an Apple Watch or other devices like a sleep and activity tracker, if there's actually like evidence that those are helpful versus just something that people like to play with?
I don't know about the specific numbers, but I do think that anytime you're being held accountable or setting a goal, putting something down and having to write your progress helps you overall achieve your goal. So numbers, I don't know exactly, but
fits into
definitely
that
help.
Accountability
Yes.
check-in piece you had mentioned. And then nights is such a disruption. I know my own experience has been that I can have a really good routine going, and then I hit even an isolated night shift or a bunch of evening shifts, a schedule change, and it all falls apart. Is there timing that is sort of around, like say night shifts, like timing for when the best time to exercise or the best time to eat is, and to not mess with your sleep or to like be able to sleep better?
So I would say if you're doing an isolated night shift, I would try the 4-hour sleep period and then wake up, stay up, and then go to bed that night. So that way you're not sleeping the whole 8 hours after your isolated night shift. Eating, not specific timing, but I would try to simulate a daytime schedule as much as you can if you're on a night shift. So exercise when you wake up, eat breakfast as you normally would, and go about your day as if it was a morning.
Even though it's
even though it would be, yeah.
So I can have my cereal at 6 o'clock at night.
Yes.
Excellent. All right. Well, thank you so much for giving us that talk.
Thanks, guys.